Have you ever stopped to think that something as simple as drinking water could be the key to keeping your kidneys healthy? Or that constant headache could be a sign that your habits are damaging these vital organs? Let's dive together into the mysteries of the kidneys and discover how small changes can avoid major health problems. Which of these habits do you think might be affecting your kidneys right now? Subscribe to the channel for more updates and enjoy this video if it is useful to you. There's another way to support our content. See the comments. Make a difference to someone's health by enjoying this video. Your collaboration helps us bring health information to more people. The kidneys are vital organs that perform several essential functions to keep the body healthy, including filtering waste products from the blood, balancing body fluids, and regulating electrolytes. Furthermore, they help control blood pressure and produce hormones that ensure the proper functioning of other organic systems. However, certain daily habits can seriously compromise kidney health, leading to chronic or acute diseases that affect not only the kidneys, but the quality of life as a whole. It is crucial to recognize and modify these behaviors to protect the health of these important organs. Dehydration. Lack of water. Adequate hydration is essential for kidney health, as water is essential to help these organs filter the blood and eliminate waste and toxins through urine. When the body does not receive enough water, the volume of circulating blood decreases, and the blood becomes more concentrated. This increase in the concentration of toxic substances in the blood forces the kidneys to work more intensely to filter these impurities, increasing the risk of kidney damage. Additionally, lack of water can lead to the formation of kidney stones, as minerals such as calcium and phosphate can accumulate and crystallize due to low urinary dilution. Chronic dehydration is particularly harmful to the kidneys. If this condition persists, it can result in more serious and long-lasting damage, including nephropathy, which is the gradual damage of the kidneys over time. This process may be silent initially, but eventually leads to a significant decrease in kidney functionality. Signs of kidney problems related to dehydration include excessively dark urine, reduced urine volume, and in severe cases, even kidney failure. Therefore, staying adequately hydrated is not just a matter of relieving thirst, but an essential practice for preventing kidney damage. To protect kidney health and promote kidney efficiency, it is recommended to consume an adequate amount of fluids daily. The exact amount may vary depending on climate, physical activity level, general health, and other individual factors. However, a general rule of thumb is to drink at least 8 glasses of water a day. In addition to water, hydration can also be supplemented with other drinks and foods rich in water, such as fruits and vegetables. Adopting these simple practices can have a significant impact on preserving kidney health and preventing future complications. Excessive salt consumption. Excessive salt consumption is one of the dietary factors that most negatively impacts kidney health. Salt, or sodium chloride, is essential for several body functions, including regulating fluid volume and transmitting nerve impulses. However, when ingested in large quantities, it can cause significant imbalances. Excess sodium in the blood causes the body to retain more water to dilute this high concentration, thus increasing blood volume. This increase in blood pressure puts additional pressure on the blood vessels of the kidneys, which are responsible for filtering the blood and can lead to high blood pressure, one of the main risk factors for chronic kidney disease. Additionally, sodium overload can decrease the kidney's ability to remove water, resulting in conditions such as swelling in the hands, ankles, and feet, weight gain, and high blood pressure. In the long term, this condition can force the kidneys to work harder to filter excess sodium, which can damage the nephrons, the functional units of the kidneys. This progressive deterioration in kidney function can develop into chronic kidney disease, in which the kidneys gradually begin to fail their essential functions. Therefore, it is crucial to moderate your salt intake to keep your kidneys healthy. General guidelines recommend limiting your sodium intake to less than 2,300 milligrams per day, which is equivalent to approximately 1 teaspoon of salt. This amount includes not only salt added during cooking or at the table, but also the sodium present in processed foods, which are often the main sources of sodium in the diet. Reading food labels and opting for low-sodium versions, as well as using herbs and spices to season foods instead of salt, are practical measures that help reduce sodium intake and protect kidney health. Painkiller abuse. Painkiller abuse is a significant concern for kidney health, especially when these medications are used frequently and without adequate medical supervision. Common pain relievers such as nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, are known to cause stress on the kidneys when consumed in excess. This is because these medications can reduce blood flow to the kidneys, interfering with these organs' ability to filter blood effectively. Additionally, NSAIDs can cause sodium and water retention, which increases blood pressure and exacerbates kidney work, contributing to potential damage over time. In cases of prolonged and unmonitored use, NSAID-induced kidney damage can progress to more serious conditions, such as acute or chronic kidney failure. This condition is characterized by the abrupt or gradual reduction in the ability of the kidneys to perform their essential functions, such as filtering waste and excess fluids from the blood. Symptoms of kidney failure include swelling in the legs and feet, tiredness, nausea, and mental confusion, which can occur if the problem is not detected and treated in time. Therefore, it is crucial that the use of NSAIDs is carried out under medical supervision, especially among individuals with pre-existing conditions that may predispose to kidney complications. In addition to NSAIDs, other painkillers, such as paracetamol, can also be harmful if used inappropriately. Although generally considered safer for short-term use, acetaminophen in high doses can cause liver toxicity and indirectly affect kidney health. Therefore, it is essential to follow the recommended dosages and consult a healthcare professional before starting any treatment with analgesics, especially in case of chronic illnesses or concomitant use of other medications that may increase the risk of kidney damage. This responsible approach is critical to preventing the negative impact of these medications on the kidneys. Alcohol consumption. Excessive alcohol consumption can have devastating effects on kidney health, contributing to a range of problems that compromise the effectiveness with which the kidneys function. Alcohol is a natural diuretic, which means it increases urine production and can lead to dehydration. Dehydration not only puts stress on the kidneys by reducing blood flow to these vital organs, but it can also result in a decreased efficiency in filtering blood. This forces the kidneys to work harder to remove toxins, increasing the risk of damage over time. Additionally, chronic alcohol consumption can cause changes in electrolytes and fluid balance in the body, essential elements in maintaining healthy kidney function. These changes can result in conditions such as metabolic acidosis, in which the body accumulates excess acids due to the kidney's inability to maintain proper acid-base balance. In extreme situations, these disorders can develop into more serious conditions, such as hepatorenal syndrome, a rapid loss of kidney function seen in people with severe liver disease exacerbated by alcohol abuse. In the long term, alcohol abuse can also contribute to increased blood pressure, one of the main risk factors for chronic kidney disease. Alcohol influences blood pressure through several mechanisms, including activation of the sympathetic nervous system, hormonal changes, and impacting the function of the cells that line blood vessels. Therefore, reducing alcohol consumption or completely abstaining from it is essential to protect kidney health, preventing the development of kidney complications associated with excessive alcohol consumption. Smoking cigarettes. Smoking is widely recognized as one of the main risk factors for several chronic diseases, including kidney diseases. Smoking has a direct negative impact on kidney health, primarily through inducing hypertension and narrowing of the renal arteries, conditions that compromise the kidney's ability to properly filter blood. Toxic substances present in cigarettes, such as nicotine and carbon monoxide, also contribute to vascular damage and increase the risk of developing atherosclerosis in the arteries that supply the kidneys. These vascular changes can significantly reduce renal blood flow, leading to a progressive deterioration in the function of these organs. In addition to vascular effects, smoking also affects the kidneys at cellular and hormonal levels. Continued exposure to cigarette toxins can cause chronic inflammation in kidney tissues, which further worsens kidney damage over time. This inflammatory process can result in fibrosis, a scarring of kidney tissues that prevents normal kidney function. Additionally, smoking can alter the levels of hormones that regulate kidney function, such as angiotensin, which controls blood pressure and fluid volume in the body, exacerbating the risk of hypertension and eventual kidney failure. Finally, studies show that smokers have a significantly higher risk of developing chronic kidney disease compared to non-smokers. This risk increases with the number of cigarettes consumed and the duration of smoking. Furthermore, smoking enhances the harmful effects of other risk factors for kidney disease, such as diabetes and hypertension. Therefore, smoking cessation is a crucial preventative measure not only for general health, but specifically for preventing kidney disease. Eliminating the smoking habit can slow the progression of kidney disease and improve the effectiveness of other treatments designed to protect kidney function. Protein-rich diet. Excessive consumption of proteins, particularly those of animal origin, can have significant implications for kidney health. Proteins in large quantities increase the metabolic load on the kidneys, forcing them to work more intensely to filter and eliminate nitrogenous waste, such as urea and creatinine, which are products of protein metabolism. This increased workload can lead to long-term kidney stress, especially in individuals with a predisposition to kidney problems or who already have a health condition compromising kidney function. Additionally, high-protein diets often result in greater calcium excretion in the urine, which can contribute to the development of kidney stones and potentially affect bone density. Another relevant aspect is that diets with a high intake of animal proteins tend to be accompanied by an increase in the consumption of saturated fats and cholesterol, factors that can exacerbate the risk of cardiovascular diseases, which are closely linked to kidney health. Studies indicate that a nutritional balance, which includes a moderate amount of protein along with plenty of vegetables, fruits, and whole grains, may be most beneficial for maintaining kidney health. Therefore, for healthy individuals and especially those at risk of kidney disease, it is prudent to moderate the consumption of proteins of animal origin and consider alternative sources of protein, such as vegetables, which are less taxing on kidney function. Lack of adequate sleep. Lack of adequate sleep is an often underestimated factor that can negatively affect kidney health. During sleep, the body performs several repair and maintenance functions that are vital to overall health, including regulating hormone levels that directly affect kidney function. Sleep deprivation can deregulate these hormones, such as aldosterone and antidiuretic hormone, which help control the reabsorption of water and salt by the kidneys. This can lead to an imbalance in body fluids and electrolytes, increasing the kidney's workload and potentially causing long-term damage. Additionally, lack of sleep can increase blood pressure, a known risk factor for chronic kidney disease. During normal sleep, blood pressure tends to decrease, providing a period of rest for blood vessels and organs, including the kidneys. However, with insufficient sleep, this rest period is shortened or disturbed, resulting in prolonged periods of high blood pressure. This places additional stress on the blood vessels in the kidneys and can accelerate the decline of kidney function in people with existing kidney disease or increase the risk of developing new kidney problems. Finally, chronic sleep deprivation is associated with a state of systemic inflammation and increased oxidative stress, both of which are harmful to the kidneys. Oxidative stress results from the imbalance between free radicals and antioxidants in the body, leading to cellular damage. When the kidneys are repeatedly exposed to these inflammatory and oxidative conditions, they can suffer tissue damage, leading to a gradual reduction in kidney function. Therefore, ensuring an adequate amount of quality sleep is not only important for overall well-being, but also essential for maintaining kidney health and preventing kidney disease. Sitting for prolonged periods. A sedentary lifestyle, characterized by long periods of sitting, can have a significant impact on kidney health. This condition, often associated with modern office work and increased consumption of digital entertainment, contributes to a number of health risks, including deterioration in kidney function. When we sit for hours on end, blood circulation tends to become less efficient, which can reduce blood flow to the kidneys. This reduction in blood flow prevents the kidneys from filtering the blood effectively, possibly resulting in toxins and waste building up in the body, which puts a strain on these vital organs. Additionally, a lack of regular physical activity can lead to the development of chronic diseases, such as high blood pressure and type 2 diabetes, both of which are known to negatively affect kidney health. Hypertension resulting from a sedentary lifestyle can cause damage to the blood vessels in the kidneys over time, while poorly controlled diabetes can lead to diabetic nephropathy. a condition that progressively deteriorates the nephrons, the functional units of the kidneys. Therefore, prolonged inactivity not only directly contributes to kidney problems, but also indirectly through its influence on these comorbid diseases. To mitigate these risks, it is essential to incorporate more physical activity into your daily life. Simple practices like taking regular breaks to walk or stretch during work, choosing to take stairs instead of taking the elevator, or establishing a light to moderate exercise routine can have significant positive effects on kidney health and overall well-being. Maintaining an active lifestyle helps improve blood circulation, reduce blood pressure, and control blood sugar, thus contributing to optimized kidney function and reducing the risk of chronic kidney disease. Ignore common infections. Ignoring common infections, especially those of the urinary tract, can lead to serious kidney complications if not treated properly. Urinary tract infections, UTIs, are often caused by bacteria that enter the urethra and move towards the bladder and, if left unchecked, can progress to the kidneys, causing pyelonephritis, a more serious kidney infection. This condition not only causes painful symptoms such as fever, lower back pain, and general malaise, but can also permanently damage kidney tissue if the infection persists without proper treatment, resulting in scarring that affects kidney function. Additionally, failure to treat UTIs can result in a condition known as urosepsis, especially in individuals with compromised immune systems or pre-existing conditions. Urosepsis is the body's response to an infection that has spread to the bloodstream, making it a medical emergency that can lead to septic shock and multiple organ failure, including the kidneys. This scenario highlights the importance of promptly treating urinary tract infections to prevent progression of the infection and subsequent septicemia. Finally, prevention and prompt treatment of UTIs are essential to maintaining kidney health. Preventative measures include maintaining good personal hygiene, drinking plenty of fluids to help dilute urine and flush bacteria from the urinary tract, and urinating frequently, especially after sexual intercourse. Additionally, at the first sign of an infection, such as painful urination, frequent urgency, or cloudy urine, it is crucial to seek medical evaluation. Antibiotics are often prescribed to treat UTIs, and, when used as directed by a doctor, are extremely effective in resolving the infection and preventing kidney complications. Excessive sugar consumption. Excessive sugar consumption can have significant detrimental effects on kidney health, contributing to the development of several adverse kidney conditions. High sugar intake, especially in the form of fructose, found in many soft drinks, juices, and processed snacks, is associated with increased risk of obesity and type 2 diabetes, both known risk factors for chronic kidney disease. Additionally, high blood sugar levels can put a strain on the kidneys, which need to filter this excess from the blood, potentially leading to damage over time. Constant consumption of large amounts of sugar can also result in glomerulosclerosis, a condition in which the kidney's filters, called glomeruli, are damaged. Additionally, excess sugar in the diet contributes to the formation of kidney stones. Fructose, in particular, can increase the excretion of calcium, oxalate, and uric acid, which are key components in the formation of kidney stones. This situation can not only cause severe pain, but also block urine flow and create infections or further kidney complications. Additionally, a diet high in refined sugars can cause imbalances in electrolyte and fluid levels, further increasing the risk of kidney stones and other kidney problems. Therefore, it is essential to moderate sugar consumption to maintain kidney health. Reducing your intake of processed foods and sugary drinks and replacing them with healthier options like water, fresh fruits, and vegetables can help lessen the burden on your kidneys and promote healthy kidney function. Adopting a healthy lifestyle that includes a balanced diet and regular exercise is crucial to preventing not only kidney disease, but also other health complications associated with high sugar consumption, such as cardiovascular disease and obesity. Unsupervised supplements and herbs. Using supplements and herbs without medical supervision can pose significant risks to kidney health, particularly because many of these products are not strictly regulated and may contain potentially harmful substances or interact adversely with other medications. Some supplements and medicinal herbs have properties that can overload the kidneys if consumed in excess, or if used by individuals with already compromised kidney function. For example, products such as creatine and certain protein supplements can increase the workload of the kidneys, leading to possible deterioration of their function. Additionally, herbs like aristoloquy can cause severe nephropathy, a kidney condition that can lead to the need for dialysis or even a kidney transplant. Another risk associated with unsupervised use of supplements and herbs is direct toxicity. Some herbs may contain compounds that are toxic to the kidneys when consumed in inadequate amounts. For example, excessive use of herbs containing compounds such as oxalic acid or large amounts of potassium can lead to the formation of crystals in the kidneys, blockage of nephrons, or even hyperkalemia, a dangerous condition caused by excess potassium in the blood that can affect heart and kidney function. Furthermore, the interaction of certain supplements with prescription medications can enhance or diminish the effectiveness of pharmacological treatment, further complicating existing medical conditions. Exposure to toxic substances. Exposure to toxic chemicals and environmental substances can have devastating effects on kidney health, given the kidney's function of filtering and purging toxins from the body. Substances such as heavy metals, lead, mercury, cadmium, organic solvents, and certain types of pesticides and herbicides are known for their nephrotoxicity, that is, their ability to cause kidney damage. When these substances enter the body, whether through inhalation, ingestion, or direct contact, they can accumulate in the kidneys, where they interfere with cellular and mechanical processes essential to kidney function. Over time, this can result in a decrease in how effectively the kidneys filter the blood, leading to waste buildup in the body, a potentially fatal condition. In addition to the direct damage caused by the accumulation of toxins, chronic exposure to these toxic substances can trigger chronic inflammation in kidney tissues. Continued inflammation can, in turn, lead to renal fibrosis, a scarring process that progressively decreases the kidney's ability to function efficiently. This not only compromises kidney filtration capacity, but can also develop into chronic kidney disease, where kidney function is irreversibly diminished. In extreme cases, this may require kidney replacement therapies, such as dialysis or kidney transplantation, to maintain the body's vital functions.